If you're in pain, you're hardly alone. Chronic pain affects nearly half, 47% of adults in the United States.
Gretchen McPhail's pain was in her shoulder, but that's not where it originated.
Now, she's here alongside Dr. Drummond of Spinal Balance Health Center. Good morning to both of you.
It's nice to see you again, and
Good
welcome,
morning.
Gretchen.
Gretchen, shoulder pain. That's what was bothering you, huh? So what was going on? What was the pain like?
Really excruciating. I was in a car accident August 22nd, and it kind of started from there.
This past August?
Yeah, 7-8 months ago.
Had you tried different methods to address the pain?
Yeah, I originally started with massage therapy, and that helped obviously for a while because it was a massage. And from there, I did trigger point injections, which helped a little bit. But I obviously knew that I needed something that would last a lot longer. So
what was the pain like when you couldn't raise your arm?
I
Or
couldn't
what was?
lift my arm. I couldn't do anything. I got 2 babies, so obviously I couldn't pick them up, couldn't carry them. At work, we use laptops to dictate on and stuff like that. Couldn't carry my laptop, couldn't really do much of anything.
You work in the medical field.
Yes.
Had you heard about NUCCA Care before? I'm wondering what got you to Spinal Balance.
My
Your mom?
mom and actually my aunt used to go see him. My mom still does see him. So
Yeah.
Mom,
you,
aunt,
so you,
cousin.
yeah.
so you go see him, Dr. Drummond at Spinal Balance Health. What did you do? Was this? Do you see a lot of shoulder injuries like this?
Yeah, any major joint is susceptible to stress because of a body imbalance. So really what we're doing, we say we're treating the top of the neck, but really we're treating the whole body to get the stresses out of the joints because of a imbalanced posture. And at the top of the neck, there's a bone called the atlas that when misaligned will start interfering with the nerves that control posture. So through an accident or an injury, and it could have been the accident, the car accident that caused the shoulder problem with her, also misaligned the top bone of the neck, and then it causes a problem like you're seeing here on these figures. The muscles on the right are pulling nice and evenly on the framework, but on the left shows what happens with an upper cervical problem is it causes muscles to tighten more on one side of the body. And once that happens, there are stresses that can settle into pretty much any joint. So it's not necessarily a problem in that joint, but it's more a full body imbalance that's stressing the joint.
She had an idea about what might have, the catalyst, possible catalyst. Some people might have been dealing with it, and really they just woke up one day and it was hurting. So do you need a specific injury to deal with it?
No, it happens both ways. Sometimes the posture imbalance puts stress into a joint that slowly starts to hurt and then cause a person an issue. And other times there's a body imbalance that is exacerbated by an accident or injury. Or it all happens at the same time where you end up with an accident that misaligns the top of the neck and it affects a joint. So there's a lot of different combinations of things to happen, and there's a lot of different treatments for the problem, but really until you get the body balanced, you can struggle.
Yeah, and I know shoulder injury. Physical therapy seems like a course of action a lot of people go to, specifically for shoulder injuries.
Yes.
Is that a good route?
It can be a very, very good route. When it comes to injury rehab, physical therapy has obviously had a lot of success. In my office, when I've seen that fail, it's because there's an upper cervical imbalance. It's putting so much stress into that area of the body that physical therapy just can't overcome it. So I've seen sometimes physical therapy not work, and then they come in and we adjust their atlas, straighten the body out, and everything just gets better. And that is similar to what happened with Gretchen. Other times we'll see it improve, and then we send them back to the physical therapist, and then their treatment is able to be more effective because they're not having to fight those stresses any longer, and their treatments seem to do real well. So it's not a one or the other. Sometimes it's both put together.
When you're in pain, the last thing you want is to go through more pain through treatment. Are these do you call them adjustments? And if so, is the process
it's an adjustment.
painless?
And since it's so gentle you don't hardly even feel it. And it was even one of the morning shows last week, they were discussing miracle healthcare cases, and there was a surgeon in another part of the country that had noticed this misaligned bone, and it was causing all kinds of health problems with a kid, and they had surgery to fix it. They cut the kid open, they realigned the bone, and he had this miracle recovery, when in fact there's hundreds of doctors around the nation right now that will do a very gentle hand adjustment that will do exactly the same thing, and it doesn't hurt at all.
But this type of care isn't as common as other types of chiropractic care.
Yeah, that's true. NUCCA, the technique that we do, is 200 or 300 doctors worldwide that practice it. So it's not very common. It's why it's not very well known, but it's very effective.
What about you and your experience here? Are you recommending it to others
Yeah,
now?
I would a lot. It's not the cracking and popping like everyone always talked about chiropractors. I like it a lot. It's helped me a lot. I can move my shoulder, I can pick the kids up, I can play. I don't have to take Advil or Tylenol every day or anything.
Wow.
I like it a lot. It helps.
Yeah,
a
you
lot.
want to stay away from that if you
Yeah.
can. There may be some viewers out there who are watching. How should they know if they're a candidate for this type of care?
I just have to look at them. It does not take me long once I get somebody in my office to identify a posture that could be being caused by an upper cervical problem. And really, 90% of the population has some kind of a posture imbalance, whether it's leading into symptoms or not. You know, that changes from person to person. But if there's a joint issue, I'll usually see a posture problem that's contributing.
Dr. Drummond brings a special offer because he knows a lot of you will be intrigued. And so to just get in and see if, in fact, you are a candidate for NUCCA care. It's limited, though, to the first 15 people who call the office. But look at what you get for $50, a consultation, an exam, and x-rays, all of that for just $50. So let's give you a phone number here so you can call, and if it's not you, then maybe someone in your life, you relate to Gretchen's story. It's 452-3400, and then online it's spinalbalancehc.com. A local doctor, something we love. We're not sending you to Chicago or Kansas City to see Dr.
Nope.
Drummond. He's in the Millard area, so it's great to see you again. And
Thank you.
And
so
Gretchen's
glad you're
just
doing
getting
well.
done with her shift, so she's going to head home and
Yeah.
go to bed now.
She needs a nap.
Thanks for
It's
coming,
true.
Gretchen.
Thanks for stopping by.
Thank you.
Thanks, Doctor.